Hi, this is Dr. Vladimir Zelenko, and I'd like to provide a update on my results. Fortunately, the number of patients that we're seeing with COVID-19 now has dropped off, and we're seeing very little new cases. But starting beginning of March, until now, I've seen 2,200 patients diagnosed with COVID-19. Most of them were diagnosed in one of three ways. One with the PCR nasal swab, that was around 500 patients. Then the rest were diagnosed clinically, based on clinical symptoms. But since the antibody test became available, we started checking for antibodies, and I have around 300 patients that so far have been positive for antibodies, not counting the PCR patients. So basically, I have 500 COVID-19 patients diagnosed with PCR, 300 confirmed with IgG antibody, and the rest were clinically diagnosed, and I'm trying to get IgG antibodies for them. But anyway, for those 2,200 patients, I divided them into two groups, high and low risk. The high risk group was around 800 patients, and those were the ones that were treated within the first 5 days of symptoms with a 3-drug regimen, as you know, of zinc, hydroxychloroquine, and azithromycin. And my results were the following: that out of the non-treated groups, the 1,600 or so, that were not treated, 100% survival. And out of the 800 that were treated, I had 2 patients that died. 4 were intubated, not counting the 2 that died, and 6 were admitted in the hospital for IV antibiotics for pneumonia. The 4 that were intubated were all extubated and went home. The 6 that received IV antibiotics also all went home. So in summary, out of 2,200 patients that were diagnosed with COVID-19, there were 800 high-risk patients, which in America it's around a 5% mortality rate for those high-risk patients. So we would have expected around 40 patients that died, and the multiple of that are approximately 100 on respirators. But what my results showed was only 2 patients died, and 4 on respirators. So it was a remarkable result. These findings have been analyzed statistically and are ready to be published. We're just waiting for a approval from an ethics board. We just want to make sure that every endorsement and every potential issue has been reviewed, because I realize that this study will be under intense scrutiny by everyone in the world who doesn't agree with the use of hydroxychloroquine. And that brings me to what I really want to talk about, is that I am aware of the Lancet study that was published, which was a retrospective study of 96,000 patients or so. And I am aware of the recommendations of the WHO to stop using hydroxychloroquine based on this study. But as you know, the study has come under intense scrutiny. The company that was involved in the data collection, Surgiscape, has gone under investigation, and Lancet itself published a editorial of concern regarding the study, that it shows potential scientific and statistical errors. So it may be premature in the WHO's hand to ban the use of hydroxychloroquine. And I am personally involved in the COVID-19 response in Ukraine with very good results. I'm working with the Prevent Senior group in Brazil, and I'm working with certain elements in Chile. And I'm sure you know I've been involved with the White House, helping them respond with their approach towards prophylaxis and treatment. And it's my understanding that the FDA is on the verge of expanding the emergency use authorization and making statements that would broaden the ability of physicians and pharmacies to use this medication and dispense this medication in the outpatient setting. So that's my update, and I hope that this information is useful. And feel free to contact me if you have any questions, and God bless you all.